As Americans are living longer and healthier lives, we often find ourselves sidelined by back and leg pain that can keep us from enjoying traveling, shopping, golfing, or even our everyday activities. Now, some think that back pain and difficulty walking is to be expected as we get older. In this morning's Your Health Matters segment, we're joined by Dr. Lisa Grant. Dr. Grant is an interventional physiatrist and non-surgical back pain specialist with OrthoMaryland, based in Baltimore, Owings Mills, and Towson. Good morning.
Good morning, Patrice.
All right, so if the back pain that people experience isn't a result of the fact that you're just getting older and you think things on your body will break down a little more, what's the major cause?
Well, the major cause, unfortunately, in the older population is arthritis and wear and tear changes like in the other joints. Unfortunately, some people think it's expected that they're going to have these aches and pains as they get older, and a lot of people don't seek treatment. But there are a lot of good treatments out there that we can do to help people live more fulfilling lives and be able to do the activities that they want to keep doing.
What is spinal stenosis? What exactly?
Spinal stenosis is a common condition we see as people get older, and it's actually a narrowing of the spine. We see it both in the neck and the back, and I'm going to be talking today mostly about the low back, the lumbar spinal stenosis, and it can cause compression on the nerves.
And so what does that make a person feel? I mean, how do they know that that's what they have going on?
Spinal stenosis causes back pain. It can also cause pain in the legs. It's worse with walking. People are usually better when they're sitting or even bending forward, pushing a shopping cart. They can have pain, numbness, tingling, weakness in the legs, loss of balance, and sometimes even loss of control of their bowel and bladder.
So then obviously that's how they know it's something a little more serious than just, oh, I've got a strain in my back today or a back problem. I mean, there's some serious issues that come along with the stenosis. All right, so how do you treat that then?
Well, options for treatment are, I like to do an interdisciplinary approach to treatment. They include physical therapy and exercise. We can do lifestyle changes, losing weight, using a cane or a walker to help get around, using medications, and also we can do injections for the back. Surgery is a last resort. And then sometimes we can also do alternative treatments if surgery is not an option.
Well, like what? What's an alternative?
Acupuncture, massage, chiropractic treatment can help in some people.
How common is this? I mean, how many patients do you have to deal with on a regular basis because of these types of back problems? In
the older population, spinal stenosis is extremely common. It's one of the most common diagnoses I see in my 70 to 90-year-old population. We really start seeing significant spinal stenosis as early as 50s and sometimes even younger in people that can actually have a congenital type of spinal stenosis where they're born with a small spinal canal to start with.
Well, maybe aside from those people, other people, is there a way to prevent it, or maybe to prevent it from getting as bad as it possibly can?
Unfortunately, there's no way to prevent the wear and tear changes. A lot of it's genetically determined, and a lot of it has to do with aging. That there are very good ways to control the symptoms. And what I tell people, this is not something we prevent or we fix. This is something we manage, and there are great ways to manage it.
Is it easier to manage if you catch it early, or does it not matter what stage it may be in?
The earlier we catch it, before people get a lot of symptoms and before they get their weight out of control, the better. We can get them in a, really the good key is getting on a good core exercise program to really strengthen the muscles around the spine to minimize symptoms and keep people active.
All right. Well, thank you so much. We appreciate you coming in. Good information. I know a lot of people probably are dealing with this. As you said, it's the most common. So this helps get them on the right path. If you would like more information about it, you can go to foxbaltimore.com/morning. And Fox 45 is stepping up to make your 2011 the healthiest year yet. The Be More Healthy Expo will be held at the Baltimore Convention Center Saturday, March 12th. You can learn about exercise, about eating right, and you can get more health screenings. Just go to BeMoreHealthyExpo.com for more information.